How to identify a raw flare. Have you ever wondered how to spot a rheumatoid arthritis flare? Understanding the signs can help you manage your condition better. And raw flare is when your symptoms worsen, especially related to joint inflammation and pain. The first thing to notice is worsening joint pain and tenderness. This pain often feels like throbbing or aching, particularly in the small joints of your hands and feet. However, it can also affect larger joints like your wrists, knees, and shoulders. Another key sign is increased joint swelling and warmth. You might notice that your joints feel tender and may appear visibly swollen or red due to inflammation. Joint stiffness is also a common symptom, especially if it lasts longer than 30 minutes after resting or in the morning. This stiffness is usually more prolonged than what you might experience with other types of arthritis. It is also important to pay attention to symmetrical joint involvement. This means that the same joints on both sides of your body may be affected at the same time, although this is not always the case. You might also find that your joint function is reduced, making everyday tasks like dressing, cooking, or even holding objects more difficult. In addition to these joint-specific symptoms, you may experience other systemic symptoms during a flare. These can include fatigue, low-grade fever, and a general feeling of being unwell. And raw flare can vary in intensity and duration, sometimes lasting 4 days or even weeks. It often occurs unpredictably and reflects increased disease activity, indicating that your immune system is more aggressively attacking your joint tissues. Recognizing these signs early is crucial for effective management. It is advisable to monitor your symptoms closely and communicate promptly with your healthcare provider. This way, you can adjust your treatment if necessary, helping to prevent joint damage and maintain your quality of life. In summary, identifying a raw flare involves noticing a combination of increased joint pain, swelling, warmth, stiffness lasting over 30 minutes, symmetrical joint involvement, and difficulty performing daily activities. These changes representing a temporary worsening of disease activity that requires medical attention.